welcome back. My name is Dr. Ivy Branin. I'm a naturopathic doctor in New York City, and as always, I'm so excited to be back in my office. If you're new to watching my channel, I highly recommend that you subscribe to the YouTube channel so that you don't miss any of the great information that I'm putting out almost on a daily basis on women's health and hormones. And of course, if you like this video, don't forget to like it, and please post any of your comments in the comment section, and I'm happy to answer any of them. So we're continuing our series on getting pregnant in your 40s, and if you remember from the previous videos, the reason I'm so excited about this topic, besides the fact that I've helped other women in their 40s get pregnant, I myself am a woman in her 40s who is pregnant. Officially, I'm at 34 weeks and I'm 43 years old. So I'm very excited about this topic. And we've been focusing mostly on the female partner, or the baby carrying part of the partnership. But today we're going to actually be focusing all on the men, or the sperm donor, the one who's producing the sperm. And I want to talk a little bit about what we can be doing to improve our partner's sperm quality naturally, specifically if they are also in their 40s, because guess what? Age doesn't just affect female fertility, but it can also impact male fertility as well. So let's kick it off. And so what are some of the main criteria that we use to determine sperm health? So definitely, if you've watched in the previous videos, if you are in your 40s and you've been trying for the past 6 months unsuccessfully, it's important that both you and your partner get evaluated. So for the male part of the partnership, or the sperm donating member of the partnership, that's doing a semen analysis, and we're looking at 3 main factors. Sperm count, so I think it's pretty obvious, the number of sperm that the person has. Morphology, so that just means the shape, and seeing what percentage of the sperm appear what we consider normal. And then lastly, motility, which is basically the movement of sperm and making sure that the sperm is moving correctly. So we want to make sure that the count is high, that they're normally formed, and that sperm is moving. Now, this doesn't kind of complete the whole picture. In fact, actually, when I was going through this process with my husband, he was very proud that he had a good count, morphology, and motility, and these are really great factors, but we actually don't have currently a really great way of testing overall quality in general. And remember, back in some of our previous videos, I've talked a lot about egg quality and how that can diminish in our 40s and can be the big factor in why we might not be getting pregnant. So what I would say is assume poor quality just in general, and that it's really important to support sperm quality. And that there's also, if we're thinking about, these first, the 3 factors, the morphology, the count, and the motility, and then the last factor that we don't know about so much, which is the quality, there's a lot of different factors that can be affecting that. Lifestyle factors, dietary, pre-existing conditions, and medications. So let's kind of dive in. What are some of the causes of male fertility problems? So kind of top of my list, and this is one that possibly could be remediated or changed, is medication. So things like SSRIs, which are antidepressants, mostly that they can actually have an effect on sexual performance, which obviously can have an impact on fertility. Our 5-alpha reductase inhibitors, things like Propecia, that are used for male pattern baldness, also can have an impact on male fertility, and some antibiotics. There's some other medications as well, but those are sort of the ones that most patients might be encountering the most. Other factors too are any kind of pre-existing conditions, things like metabolic disease, diabetes. There are some conditions that do affect the structure and the ability of the male penis to get erect and ejaculated and everything like that. And so really having a big factor on sexual performance. And I really can't stress this enough as well, is that definitely anxiety, depression, whether even if it's not medicated, could be a major impact in fertility. The other potential cause of fertility problems is obesity. So this is considered BMI over 29 or 30. And the reason is that obesity affects testosterone levels. And if you've watched some of my previous videos, I have talked about how testosterone is converted into estrogen ideally in female sex. But when there's a lot of adipose or fat cells, you're going to have more of a conversion of that testosterone to estrogen, which is going to have an impact on semen production. You're also going to show lower sex hormone binding globulin. And so all these definitely can be impacted by BMI. The other kind of changeable factor, smoking. So smoking does negatively impact sperm motility as well as the fluid quality, the actual semen quality. This is both, I would say, both for regular cigarette smoking, but also marijuana can also have an impact on fertility. The other kind of thing that sometimes goes along with smoking is alcohol use. So excessive alcohol use has also been shown to impact sperm motility and fluid quality, morphology, and just lowers production in general. Two other conditions that often, specifically if I have a patient whose partner does have a low sperm count and doesn't have a lot of these other factors, other things you want to rule out are hydrocele and varicocele, and that's sort of like an abnormal vessel formation that can adversely affect sperm production. And it's actually it's simple to diagnose. Any urologist can diagnose it, and it's also very simple to treat. It's an in-office procedure to treat, and typically we're going to see, if the treatment is effective, within 3 months we should see those counts go up dramatically. Two other big factors, any past infections could have an impact on fertility. And then lastly, celiac disease. Mostly I would say celiac disease due to effect on specific nutrients, specifically if the patient has not been adequately diagnosed or was late diagnosed and it wasn't treated properly. So celiac could also potentially affect male fertility. So you might be wondering, what are some of the ways that we can increase sperm count naturally? So if we're thinking back on, again, like the previous list of some of those factors, definitely getting your partner maintaining a healthy body weight between a BMI of 20 to 25. Also, adding more exercise. I didn't mention this in the fertility problem part, but exercise definitely depending on the type. So prolonged bike riding, because of the compression of the testicles during bike riding, could actually impact fertility, but other forms of exercise should actually improve fertility. Increasing fruits and vegetables, basically because these are good sources of vitamins, minerals, and specifically antioxidants. And again, if we think back on when I was talking all about egg quality, it was all about antioxidants and supporting mitochondria. Well, guess what? Sperm are also cells, and it's a very kind of similar mechanism. And then lastly, kind of like in this dietary piece, is decreasing red meat and alcohol consumption. So then let's talk about some of the supplements that I might recommend specifically to help not just increase sperm count, because as I mentioned before, it also is really important that sperm quality is robust. So what are some of the things that I often recommend? So I definitely recommend a high quality multivitamin with at least I'd say about like 25 milligrams of zinc, high in selenium, either 100, 200 milligrams, vitamin C, vitamin E, A, and then D, depending on what the partner's levels are at. So anywhere from like 1,000 to 5,000 IUs. Omegas, so omegas are definitely going to help with motility, morphologies, and count, so high omegas. And then so some of the more specific supplements to look at are L-arginine. So L-arginine can improve sperm counts and motility. In fact, the studies actually have shown that supplementing with L-arginine within 3 months actually improves these markers. And then really focusing a lot on, again, oxidative stress, because it's the oxidative stress that is going to impact mitochondria and is going to lead to defective spermagenesis, so like basically the creation of sperm, which is actually the leading factor when it comes to male factor infertility. And so the three main nutrients that I recommend specifically for the oxidative stress piece to really improve quality is L-carnitine, and there's one in particular by Designs for Health that I like. It's their carnitine synergy that also has acetyl L-carnitine, then ubiquinol, typically usually about 200 milligrams, and then lastly alpha lipoic acid. Again, we want the R alpha lipoic acid, and if you remember back from previous videos on egg quality, it's very similar with men as well. And I found, again, because sometimes men, or just, who wants to take a lot of supplements, but I was able to actually create a plan for my husband that only involved 4 supplements or 4 capsules, and basically one of the L-carnitine as the Designs for Health, ubiquinol, and alpha lipoic acid, which he just took at night, and then he was already on a multi that I had already prescribed, and he had been taking omegas for a year. So that was kind of a little bit of his plan. And as I mentioned in previous videos on egg quality, ideally, again, we want to start our partners as early as possible. So I'd say ideally about like 3 to 4 months prior to starting to get pregnant. So hopefully you found that helpful, and hopefully you can bring that home and maybe start your partner on some of these supplements and recommendations. So of course, as always, we're open, and we'd love to maybe have a consultation with you. Also, any of the supplements that I have been recommending in any of my videos, you can easily purchase those by accessing my full script. And if you're a new customer, you will receive 10% off your first supplement order, and we'll probably have like an exact protocol of exactly what I had recommended in the little descriptor of the YouTube video. And then lastly, of course, please subscribe to my YouTube channel. I don't want you to miss anything, because I'm actually going to be putting on many more videos all about 40s and fertility. I don't want you to miss any of the good juicy tidbits. And of course, if you like this video, don't forget to like it, and also feel free to put in a comment. So looking forward to seeing you next time. Dr. Ivy Branin.